torn meniscus is a tear to the semicircular tissue in the knee joint. Each knee joint has two crescent-shaped cartilage menisci. These lie on the inside and outside of the upper surface of the tibia. The cartilage menisci act as shock absorbers and provide comfort for the knee joint. The medial meniscus on the inside is more prone to the injury than the meniscus on the outside, as it is connected to the ligament and the joint capsule, making it less mobile. There are different ways to tear your meniscus. A longitudinal tear occurs along the length of the meniscus and can vary in length. A tear from the edge of the cartilage inwards is known as a radical tear. The bucket handle tear is an exaggerated form of a longitudinal meniscus tear, where a portion of the meniscus becomes detached from the tibia, forming a flap that looks like a bucket handle. The most common cause of cartilage meniscus injury is twisting the knee with the foot planted to the ground, either with or without contact from another player. This can include sports such as deadlifting, netball, basketball, tennis, soccer, and baseball. A cartilage injury often occurs in conjunction with injury to other structures in the knee, such as anterior cruciate ligament injury or a medial collateral ligament sprain. Meniscus injuries can also occur over time due to degenerative changes or wear and tear in the knee joint and is more common in the older athlete. This leads to the edges of the meniscus becoming frayed and jagged, increasing the likelihood of a meniscus tear. Other types of meniscus tear are the flap tear and the horizontal cleavage tear. Torn meniscus will usually have a history of trauma or twisting of the knee at the time of the injury, although they can come on gradually through degeneration or overuse. Pain will be felt on the inner surface of the knee along the joint line. Swelling of the knee may occur within 48 hours of the injury, with the athlete being unable to fully bend knee. If the injury is severe, then the athlete may be unable to put weight on the affected leg. The athlete may also complain of knee locking or giving way. According to WebMD, 1 week after the injury, simple knee flexion and extension should be undertaken with the aim of maintaining range of motion to the injured knee. You can then progress to a double leg calf raise, and extension and resistance band hamstring exercises can also be done on a daily basis. If it isn't painful, use a cycling machine to maintain aerobic fitness. You should aim to walk normally with full weight bearing on the injured leg. 2 weeks after the injury, continue with flexion and extension knee range of motion exercises to regain full range of motion in the joint. Begin to do shallow squats and lunges, but only if it doesn't hurt. 1/4 normal depth is sufficient to start with. Leg press machine exercises that can begin with both legs initially moving onto a single leg exercises. Other exercises which can begin include step-ups, hip bridges, hip abduction and extension with resistant bands, single leg calf raises, and wobble balance board drills. Continue with exercise cycling if it's not painful, walking normally without a limp, and if possible light swimming, but only very gentle with the leg kick. The athlete should be returning to normal sports-specific training. Start doing part of the training session and gradually build up to completing full sport-specific training sessions. Sports like netball put a lot of weight on your knees from quick changing direction, so there is a chance that you will tear your meniscus in APS sport. To prevent this, you can properly warm up before by going for a light jog, then stretching afterwards. You should always work with a certified strength and conditioning coach to ensure proper lifting techniques for exercise such as deadlifting in the weight room. If you already have bad knees, you can use knee splints such as short sleeve knee supporters or a hinged knee brace to protect your meniscus from tearing.